Now we will come to, we have done the cause model in occupational diseases, and we have done the prevention and control. I will just revise for you and very go fast. The causes we have thought of is or studied are physical, chemical, biological, mechanical and psychosocial. So these are 5 are our agent groups. Then there are host factors and there are environmental factors. That triangle we will use, epidemiological triad we will use. And preventive model we have seen the medical measures, the engineering measures, the personal protective measures and the legislation, the ESI and the Factory Act. Now with this knowledge in your background, you should be able to do the health hazard or prevention and control in any occupation. The most commonly asked is agriculture workers. But there is no reason why I can't ask you what are the health risks of healthcare workers. After COVID it will be my favorite question. Or I can ask, say, what are the health hazard of people who are using computer, or bank employees, or rickshaw pullers, or coolies, or shopkeepers, or office goers, anybody. We can manage it. That is the generalization part. You have to think from what are the hazards from these 5 points of view. Let us take agriculture worker. So agriculture worker, physical agents, he is exposed to heat, he is exposed to cold, he is exposed to noise, he is staying close to airfields, he is exposed to humidity, he is exposed to ultraviolet rays. But we should not write pressure. We can avoid writing vibrations. We can avoid writing exposure to Casein's disease or these things. That much intelligence we have to show. Chemicals, he is using fertilizer, he is using pesticides, insecticides, so he is exposed to organophosphorus compounds. Then comes biological, there are diseases which are specific to biological workers. He is exposed to snake bites, let us say, animal bites. He is exposed to tetanus because of his injuries. He can be exposed to bovine tuberculosis because he is dealing with agriculture, animals he uses. So we can think of. Then we can think of psychosocial. Suicides are common and coming in news, so we can always mention suicides and this thing, and others also because of financial, even going to anxiety, depression and psychosocial diseases. And mechanical, he is using machines. In Punjab earlier Toka injuries were very common, and now he is using tractors and he can go into accidents, electric shocks, accidents. And prevention, we can write down again medical measures, engineering measures, personal protective measures and the legislation. Now remember, legislation, agriculture worker, these legislations will not be applicable in his case. So we have to do the answer with intelligence. We can't be fools writing our answers. The intelligence must come. We can write down that there is, like Ayushman Bharat is a legislation or a scheme which has come for them, in which small agriculture workers, farmers are there. In my notes I have very nicely, nicely means it's unique to me, I have written that agriculture workers, migrant laborers are prone to STDs and HIV, because if you read HIV, single male migrant is a risk factor for HIV infection or STDs. So this type of knowledge we can combine. Similarly, you can write health workers, they are exposed to physical agents. Health workers, nurses have to lift patients, so they get backaches. They are exposed to, we can write down, they are exposed to noise, they can exposed to IR-RADs, they are exposed to chemical agents, lab workers may be exposed to chemical agents, anesthetists or people working in operation theatres are exposed to gases, biological agents is no problem for us. Mechanical also we can write down. There are some machines which are being rotating or used which can cause injuries. We do get needle stick injuries, which is not exactly mechanical, it should go into physical part. And then psychosocial aspects. Doctors do commit suicides and go into depressions, anxieties and stress, and these days the violence against doctors is there. And similarly we can. So I will not going into detail of individual, but with this basic knowledge, you should be able to, with your intelligence and some thinking at the time of examination, should be able to do any occupation in the world and score, why not score 70% of marks in that question. So this part I am stopping here. Next time I will go to pneumoconiosis, and next or time permitted I will just do ergonomics. These two topics we will do, and then I will finish with occupational health, because I want to go into subjects which require basic, more of understanding than rectification. So I will go to screening, epidemiology and basic concepts in infectious disease epidemiology. Thank you.